One of the most common concerns that people have with a bullet injury is what happened to the bullet. Is it still inside or did it pass through? Bullets or large fragments bigger than a quarter inch, can remain inside the body, and the truth is, often are left inside. Most people will not have their bullet removed in the hospital unless they require an operation for a life-threatening injury, like a broken bone or a bleeding blood vessel. In that case, many people do still have bullets inside their body. On top of that, about half of the people who are seen in the emergency department will be sent home without being admitted to the hospital. What does that mean? At the BRIC, we see over and over again people who have bullets in their bodies. If that's you deserve to know your options for what can happen if you have a bullet left behind. When bullets go through the air and pierce our skin, they go through our tissues layer by layer and generally slow down. Sometimes they do go straight through, but they can stop at different levels. At the BRIC, we define those levels from a 1 to 5 scale. The skin, the fat underneath the skin, the muscle, the bone, and the body. That is how we define the stage of a bullet injury. Knowing where your bullet is can help you and your doctor decide what you're going to do about it. For bullets that are close to the surface, level 1 or level 2, if they're less than an inch deep, they frequently can be taken out. But if they're deeper, like down into the muscle or even by the bone, it can be difficult to remove the bullet. So another thing people frequently worry about is whether or not the bullet will go deeper and create more harm. As a trauma surgeon, having taken care of people who were shot for years and years, I have never seen a bullet go deeper. In general, they work their way out to the surface. So that's a concern that I don't think you have to worry about. Still, it's good to know where your bullet is and to follow it over time. If it's not possible for your bullet to be removed, it's important you make a plan for following up in the weeks after your bullet injury. You deserve the answers on what your options are and should again talk to your treatment team about what can happen next. The kinds of concerns you'll face if the bullet is left inside are serious though. That includes infection, muscle spasms, numbness, cold sensitivity, weakness, and even lead toxicity. These concerns are valid and an important part of what you should discuss with your treatment team. At the BRIC, we take the following approach. For level 1 and 2 bullets that are an inch or less deep, we make sure that people have a chance to get the bullet removed. Sometimes that includes waiting 7 to 21 days if there's too much bruising or swelling in the area to make it safe for the bullet to come out. For bullets that are level 1 and 2, but deeper than an inch, we use ultrasound to see where the bullet is and to follow it over time by repeating that in follow-up visits. For bullets that are deeper than that, level 3, 4, and 5, we suggest routine ultrasound and lead testing. If you have a bullet left in your body, no matter what, the choice for what happens should be yours. Talk to your treatment team and get follow-up if the bullet is still inside you. Whether it can be taken out or left behind, you deserve ongoing care. Retained bullets are serious and they matter. Knowing what steps to take are an important and central part of your right to heal.